All right, heartburn sufferers. Today, we want to talk about what are driving your symptoms. It's going through your head. What is actually causing this pain? When I eat, the heartburn, the acid reflux. We're going to talk about that today in this video. It's your lucky day. And at the end of this video, we're going to talk about an offer, a free offer, to actually figure out what specifically is causing your symptoms. All right? So let's talk about your process in terms of figuring out what your symptoms are. If you're working on this from your own perspective without seeing a doctor, some of the things you want to think about right away are, do you drink alcohol? Alcohol causes an increase in acidity in the stomach, and that can cause some of these acids to go up beyond this lower esophageal sphincter. Think of it as a valve that sits right above your stomach where the food comes down from the mouth, down the esophagus, and passes through this valve. And as soon as you finish up eating, that valve closes down. So that way the food can't come back up. All right? Alcohol irritates that valve, forces it open, and causes those acids to come up through. A lot of the things on this list do that exact same thing, the exact same mechanism. So if you drink alcohol, that's a problem. You should consider cutting that back or cutting it out and seeing if that helps. Number 2, tobacco. Whether you smoke, whether you chew, whether you vape, you're getting a relaxation of that valve. So after you eat, that food should be kept right here. But if that valve opens up because tobacco or nicotine in particular relaxes that sphincter, well, now the food's going to come back up through. Okay? You should stop. For many more reasons than just acid reflux, you should stop with tobacco. Number 3, you could have obesity, right? You could just be overweight. And all of this abdominal fat here is putting pressure up into your stomach. Your stomach is being squeezed from underneath by this abdominal weight, and so your stomach has less room to work. It's putting pressure up into that valve that we talked about. It's going to force it open and cause acidity to push up in there. Heartburn, acid reflux. Pregnancy could do the same thing. Okay? Obviously, you're growing a child, tummy getting bigger, same exact mechanism. Number 5, diet. Okay. Now this is something, of course, you've probably figured out on your own. There are certain foods that are going to cause your heartburn, your acid reflux. The 3 most common: fatty foods, fried foods, and I'm blanking on it. Spicy foods. There we go. I knew I'd get there. Fatty, fried, spicy. Usually one or all 3 of those can cause problems for people. There are other food sensitivities that some individuals may have, but those are the big 3. All right? And then the last one that's most common is stress. Reducing your stress wherever you can. These 6 things can all be dealt with by your own or on your own. And if you go see your doctor, they're very likely to ask you these things briefly, small questions. Do this, are you pregnant? They can see if you're obese. And their solution is to these issues is to do one of 2 things. 1, over the counter, things like Rolaids, Tums, antacids, basically. Use those. If you use those, and those haven't helped, then they'll go to the medication route, and they will prescribe a PPI, a proton pump inhibitor. Okay, we'll just say, well, screw it. We'll just get rid of all your acids and just basement level knock out all of your acids so that when you eat, you have no acids to actually come back up. That seems like a problem, doesn't it? And we're going to get to that in just a second. In fact, in just a moment, we're going to talk about how you need to figure out why this is the wrong approach, and slapping a Band-Aid on this problem is going to make a long-term problem for you down the road. In fact, several of them. Okay? So hang tight. We're going to get to that. So we have these 6 things. Those are obvious. All right, here's some less obvious ones. Eating habits. Not something your doctor will go over with you, but can cause you issues, such as if you tend to eat on the run, and you're go, 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 and you don't take time to stop, relax when you eat, it can cause you acid reflux. If you eat before bed, within an hour or two before going to bed, your body or your stomach hasn't fully digested, you go to lay down flat, and now that food has an opportunity to come back up through because of gravity and push up into that lower esophageal sphincter, creating acid reflux. All right, these are some things your doctors typically don't even ask you, but you need to be aware of. Okay, another one is, and this is common, I just had a friend, a good friend of mine who's dealing with this, and I'm like, well, what do you do after you eat, or what position do you eat in? He eats on a couch at his house, and this couch, when he sits in it, is a poorly designed support, and he kind of slumps over. He's kind of slumped in his couch as he's eating, watching TV. Well, with your stomach and chest and everything curled up like this, trying to eat, you're trying to put food into a stomach that has this much room, and you're smashing it down. It's almost like you're creating an obesity mechanism in the stomach, right? You got to sit up straight. You got to eat and give your stomach plenty of room for that food to get down in there, and so the stomach can do its thing without being compressed, forcing acids up into your throat, okay? Eating habits. Another one, that's a big one. Hiatal hernia. Your doctor knows what this is. Your doctor is not testing you for it. Why? You can. This is a disruption or damage to the diaphragm, which is this basically horizontal trampoline underneath your lungs, and when you need to breathe in, the diaphragm drops to give your lungs room so that air can come in the mouth and down into the lungs. And when it's time to breathe out, the diaphragm relaxes, the lungs contract, and the air moves out. And we do this obviously hundreds of times a day, hundreds of thousands of times in our lifetime. So the diaphragm, though, sits right above the stomach. And the stomach right here, if there is irritation or damage to the diaphragm, the stomach can push up through that. So if you look at it from the top, the diaphragm should be a solid sheet with one small hole where the esophagus runs through. But if there is a damage around that hole, you can start to get an opening where the stomach starts to push up through that diaphragm. The stomach is not staying down here. Part of it's sticking up through. That's a hiatal hernia. And the acids get up into that little pocket and create heartburn and acid reflux. And that is something you can you can actually diagnose very easily. You can do a CT scan. You can do an endoscopy. But your doctor has to prescribe it. And oftentimes they don't want to. They just want to give you a PPI and not actually get to the real cause. We can help you with that. We can send you for a CT scan. We can recommend you go see a GI doctor and get an endoscopy done. An endoscopy, if you don't know, camera into the mouth, down the throat, and they can look what's going on in there. They can see what's happening, okay? Hiatal hernia, that's a big one. The other one they don't talk about are prescription meds. Well, guess what? There are medications which can cause you acid reflux. The biggest ones and very common ones are ibuprofen and aspirin. Most people don't even know that. Doctor doesn't even tell you. Are you on ibuprofen because you have some joint pain? You get headaches? Well, that very likely could be causing you your acid reflux, this heartburn, all right? Aspirin, same thing. If you're on aspirin, like as a blood thinner or just because you're taking it to help with certain conditions, that can cause you acid reflux. Another one that can are blood pressure medications. If you are post-surgical, or if you have a heart issue or a heart murmur, or you have some sort of cardiovascular issue going on and you've been prescribed blood pressure medications, those can cause heartburn. Is your doctor telling you this? You got to be aware of this. And sometimes there are some meds you need to switch on to and off of another to make that happen so you can still get what you need. And the last one, which is the most obvious to me as a functional medicine doctor, But the least obvious to your doctor is infection. And the biggest culprit here is H. pylori. This is the least addressed, poorly treated cause of heartburn on this board. And it's the one that we see most often because it gets missed time and time again. This is my offer, right? We need to find out if you have H. pylori, okay? I can find out for you. We can test for it. And if you have it, we're going to kill it. Plain and simple. It's that easy. And my offer is this. Call my office and set up a free call so we can figure out what's going on with you, hear your history, see your symptoms. But if this is going on, your doctor's not testing you for it. And even if they do, which is probably a 2% chance they're actually going to test you for H. pylori, more than half the time the test they use will tell you it's not there, and it is. You get more false negatives than you actually get accurate results. It's called a breath test, and they have you breathe into a bag, and they test the results, and it's not an accurate test. And the research shows this is not an accurate test. They keep using it, the insurance keeps paying for it, and it's giving you false hope. This needs to be properly addressed. So, in the link to this video, there is a description. You can actually set up a free call with us. This is where we start the process, all right? You gotta find out if this is the problem. All these other things we can also deal with patients and walk them through that, but a lot of this you can just do on your own. This one you have to figure out. If you have a hiatal hernia, you have to get that figured out. These are the two main ones that we help with, all right? In our office, then, we can determine, if that's the case, let's get after it and knock it out. It's a bacteria, and we got to do this. Now, you might be thinking, I don't know where this doctor is. I'm in Iowa, and I can't actually get to where they are. We see patients from all over the country. We do telehealth visits. We can help you. If we need to do testing, we can make sure you get that testing and find out what the results are so that we can actually get you better and address what's driving your acid reflux symptoms. Don't guess anymore. Don't suffer anymore. Let's find out what's causing your heartburn symptoms and get you better feeling today. Take advantage.